Siem Nasiaya, Ait Squil. My name is Brennan MacDonald. I'm the Vice President of Regional Operations for the Vancouver Island region at the First Nations Health Authority. I'm joining you from the unceded traditional territory of the Stiminis peoples. Throughout the last year, we have worked together to address what's been most important to Vancouver Island First Nation communities. We have continued our focus on supporting community-led responses to address the toxic drug crisis, increasing the presence of youth and youth voices in our health planning and implementation, and urgent and emergent needs as identified by the nations we serve. We have also continued our work in improving services across the region through our partnered work with Island Health. Our work to respond to the toxic drug crisis was a key focus for 2022-2023. The Vancouver Island Regional Team has expanded the mental health team to better support the community requests related to harm reduction, substance use, treatment and wellness center navigation, and developing community-based initiatives. As part of the Partnership Accord Mental Health and Wellness Workstream, priority work this year included efforts to improve access into existing treatment beds across the region. Island Health is entering into new agreements with FNHA funded treatment centers to add additional 10 beds to the Cots Common Treatment Center in Port Alberni and 5 new beds to Southern Laleham Healing House in their new Cowichan Valley location. The Vancouver Island Regional Team continues to walk alongside and support First Nation communities in mitigating and responding to the devastating impacts of the ongoing toxic drug health crisis. On November 9th, 2022, the FNHA and Island Health hosted a toxic drug crisis forum to gather insights and recommendations from First Nation leadership to address the public health crisis. These recommendations were presented directly to the BC Minister of Mental Health and Addictions, Sheila Malcolmson, at the Vancouver Island Regional Caucus on November 10th, 2022. Our work to improve services over the last year included the launch of our monthly Lunch and Learn webinars as an informal space to create connections by inviting our health system partners to share their knowledge and discuss topics of interest for communities. These initial sessions targeted substance use, harm reduction topics, and have now expanded across the continuum of mental health services. Our communities have been quite active in planning for mental health and wellness improvements, including the Cots Common Rebuilding the Circle program. The program is a direct intervention that is CUASA-based, trauma-informed, and holistic, with the ultimate goal of healing the impacts of sexual harm in families and communities and preventing further harm. This past year, from the direction of the Vancouver Island Regional leadership, we focused on youth inclusion with the intention to develop a youth council moving forward. Youth were invited to gather in wisdom, the Provincial Health and Wellness Summit, the Vancouver Island Regional Spring Caucus, and we encourage more youth participation in future caucus meetings. In the last year, Vancouver Island leadership renewed the Vancouver Island Partnership Accord with FNHA and Island Health. The renewal included the addition of the First Nation Health Directors Association regional representatives to recognize the critical role health directors carry in this partnered work. We do this work led by community and in partnership with Island Health. Under the commitments of the Accord, anti-racism, cultural safety, and humility remain a top priority for the region. We raise our hands to the UBC Strathcona Family Medicine Residency Program as it celebrates its 5th anniversary of learning from the local Likwita nations who help residents learn about the land they're practicing on, including traditional medicines used in the area, the history of Indian hospitals and residential schools, and their role as physicians in that how trauma impacts the brain and the body. Workshops are offered by the FNHA primary care and quality teams to provide a safe space for nations to step into the teaching role, which gives residents a better understanding of how to do their work in a good way. The FNHA regional team gathered at Transfer Beach in Staminas Territory in Ladysmith in recognition of the 2022 National Day for Truth and Reconciliation. It was an important opportunity to reflect on what we can continue to do as individuals and as an organization to advance reconciliation together. Elders Bill Cramner and Cliff Atleo spent the entire day with us, grounding our spirits by bringing forward some of their wisdom to guide and connect us in heart and mind. I want to offer my appreciation to the leadership and health teams of all our communities for our collective efforts to advance our interests in health and wellness over the last year. Our work is always guided by the First Nations we serve, and we welcome engagement with communities during our spring and fall caucus meetings and throughout the year. To learn more about our work together, be sure to read our annual report located at fnej.ca. Hi, Jim.